Welcome everyone. Thanks so much for joining us today for our second webinar on transition to the Health Professions and Occupations Act. My name is Diane Millette. I'm the Registrar and CEO of the College of Health and Care Professionals. And with me today is Chris Smurden, who is our Director of Registration and soon to be renamed to Licensure. And we're really delighted that you've are joining us today. So the focus of the webinar today is on licensure, and Chris is going to do most of the talking about that. I would like to just acknowledge all the feedback we got on the licensure bylaws. I think we received 484 comments on the licensure bylaws, so more than any of the other sections of the bylaws. And we have taken time. Joanne Bouchard, who is our HPOA transition officer, has read every one of those 484 submissions. And we have made a number of changes to the licensure section based on that. And Chris will speak to some of that in a few minutes. I'd like to mention that the majority of comments were with respect to the bylaws addressing vaccination requirements. And again, Chris is going to speak to this in a little more detail, but just to remind all of you on the call that the bylaws that are permissible under the Health Professions and Occupations Act are twofold with respect to vaccinations. One is that the college must collect vaccination information if it is the result of an enactment, so a public health order, for example, as many of you would have experienced during the pandemic. The other is that the college can make its own bylaws with respect to collecting vaccination information, and we are not enacting the second one. So we only have bylaws that reflect the reality for us in the HPOA that if there is a public health enactment, for example, or another enactment that requires us to collect vaccination information, that we will be doing that. So hopefully that helps. I know that there were a number of people quite concerned about the fact that we might be collecting all kinds of information about vaccination, and that is not the intention. So I think with that, Chris, I'm going to hand it over to you to start the conversation about licensure, and then I'll speak to you at the end of the webinar.
Great. Thanks very much, Diane. Before we start, I'll just indicate that I'm at the college office today, and I'd like to acknowledge that it's located on the ancestral and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh, pardon me, nations. I'm grateful, very grateful to be here. And of course, there we go. Here's what I'm hoping that I'll cover today. I'll start with an overview of what's changing and what is not changing in these bylaws. And then we'll look in more detail at some of the bigger changes that we received comments about after when the bylaws were posted for consultation. We'll look at in more detail at those, and then I'll spend a couple of minutes talking about what you can expect in the lead up to April 1st and then after. I have about 13 slides or so. When I've timed it out, it comes out to under 25 minutes, so we should have enough time for questions. We'll start with the ones that were submitted in advance, and thanks very much to those of you who did that. And we should have time for others, but I'm not sure. We'll just see how we go. Okay. So the overview of what's changing and what isn't. Let's start on the left side. So what's not changing? Entry to practice exams. So other than removing some exams that are no longer offered from the current schedules, that there have not been any changes. We did receive a question about entry to practice exams and whether the college would make sure that exams, I'm just reading this off, are Canadian rather than administered out of the US or other countries. So the license committee is responsible for making those decisions, and then in turn to recommend to the board whether a bylaw amendment is required for that change. When they're considering making a change like that, there's a number of factors that they consider, but first and foremost is whether the exam reflects the Canadian practice context and whether it serves the purpose of protecting the BC public. So, like I say, there's no, other than removing the ones that are out of date, there have been no changes to entry to practice exams in the bylaws for April 1st. Also not changing, the committee will still meet, this committee, which will be the license committee at that point, they'll still meet in profession-specific panels. That's what we do now. So that will continue. Also not changing the recognized education and practical training programs. If anybody's gone through the bylaws, not even with a fine-tooth comb, the structure has changed compared to how they are written now. Right now, you'll have, we have a section of what we refer to as the body of the bylaws, and then every profession for licensure issues has a schedule. And within those schedules, at the end of them, there are tables that include the recognized education programs, the entry to practice exams, and sometimes there's additional tables. We've changed that. So when you're looking for this information, it will appear to be in a different place. But what we've done is harmonized the bulk of the body of the bylaws. We'll talk a little bit about that in a minute. And then what we have in schedules are, there's an entry to practice exam schedule, and it lists them by profession. There's a recognized education and practical training program schedule, and it breaks it down by profession. So basically, we took all of the recognized education and practical training programs from the current tables in the schedules, and we've just reorganized where they're appearing in these, but they're all still there. What is changing? So we will have a permit committee, which is will be the committee that directs the regulatory program for health profession corporations. For license committee meetings, I think there's going to be more of them, at least in the initial stages, because of additional requirements that are required by the HPOA processes. Obviously, terminology is changing, and we're going to talk a little bit more about that. There's significant changes to the classes of license, and we'll spend probably most of the time talking about those. We'll talk, there are changes to reinstatement because we're harmonizing requirements on that, and we'll spend a few minutes talking about that. Also, certified practice renewal. So, pardon me, terminology through certified practice renewal, we're going to go through in a little bit more detail. Okay, so this is the main points that you just need to be aware of, and it's probably self-evident. Currently, obviously, we're registrants, and the process to become, listed with the college is registration, but we'll all be called licensees as of April 1st, and you will have, instead of being approved for registration, you'll get a license, and the overall process and department is licensure. And actually, my department is already called the licensure department. We anticipated that with a little bit with amalgamation. Now, as I already mentioned, the registration committee will become known as the license committee. And then I wanted to flag, and we'll talk about this a bit more when we're talking about classes of license, but there's a change to what we refer to as currently. For example, occupational therapy has a provisional class of registration. Audiology, hearing instrument dispensing, and speech language pathology have a conditional class, and dietitians have temporary class. This is the class that is for when people have met the education requirements, but might not have met the entry to practice exam requirement yet. So they're often offered this class of license until they pass the exam. We're changing what it's called. They'll all be called provisional as of April the 1st. Pardon me. Like I say, we'll talk a little bit more about that one in a minute too. Okay, there are quite a few changes pertaining to classes of licensure. The first big change is that all of the professions that are regulated by this college will have three main classes: full, which is basically independent practice; provisional, which I've just explained is the class that you're in if you're waiting to take the entry to practice exam, generally that's what it's used for. And then a temporary class, which will be a time limited, 30 days maximum, generally for when someone wants to come from, who's registered in another, licensed in another jurisdiction, and is intending to come to BC to teach a course that has a practical component, take a course that has a practical component, or for continuity of care. If there's a person who was resident in another jurisdiction, for example, in Canada, only in Canada, and moves to BC, if their health professional in that originating province needs to provide a bridge to before they find a service provider here, that it could be used for that as well, under very limited circumstances. But there's some other changes that we'll go through now. So provisional class is under the HPOA. All professions are required to have a provisional class. Currently, 5 of our professions have it and 4 of them don't. So opticianry, optometry, physical therapy, and psychology do not currently have this class. We are working on the fleshing out the details of this because, as you can imagine, the legacy colleges provisional class, they all have slight variations in the eligibility criteria, how long they can be granted for, what causes them to be expired or canceled. So we're working right now to harmonize the terms and conditions of that class so that it meets the needs of each of the professions. Some of the professions that currently don't have provisional, they might not even use it. We don't know what that will actually how that will materialize, but we are required to have it under HPOA, so we will. The furthest we've gotten right now, I mean, there's a lot of things that we're putting together, but it'll be for a provisional class will be granted for a maximum of 12 months. And licensees in that class will need to work under some form of supervision. I'm sure many of you know that the non-practicing class is being discontinued under the HPOA compliant bylaws. We've communicated about this already, so I won't spend a lot of time on it. We have emailed all of the non-practicing registrants in the professions that have that class to inform them of their options. And I know that there's a lot of back and forth with individuals who are have questions about how to proceed. But I just wanted to remind everybody, because we still get this question about why we're discontinuing it. And the decision was made basically for 2 reasons. One, the class was originally set up, we think, for 2 reasons. One, in the days when we didn't have email, we didn't have websites, and it was a way to stay in touch with the college, receive those paper newsletters you used to get in the mail, and that you wouldn't get if you were completely canceled your registration. So it was a way to stay in touch with the college, and that's really no longer necessary. All of the information we have is available on the website. The other reason that people, I don't know if it was originally set up this way, but I know that people think it is this way, that they think that there's a faster route back to full or independent practice if you're coming from non-practicing. And that's no longer the case. There's no faster route back to full than there would be if your registration had been canceled and you're trying to come back from a former category. So for those 2 reasons, that we really didn't see the need to keep charging people for benefits that really they weren't benefiting from. In addition, after April 1st, and we're going to talk about this, reinstatement from former will be a very, very straightforward process after short absences from practice or from being registered in BC. So we'll talk about that. I know that there are specific concerns, particularly in the psychology profession, around custody of clinical records. So currently, the Legacy College of Psychologists Code of Conduct, which is still in effect, requires that psychologists be registered with the college in order to maintain custody of and control of their clinical records. Otherwise, they have to assign or request that another registrant be the executor, professional executor for their records. As of April 1st, that code of conduct, that legacy code of conduct, will no longer be in effect. You've all received emails about asking you to contribute to a survey on the harmonized set of standards of practice. And in there, it removes the need to be registered in order to maintain custody of your records. All registrants, whether they're registered or not, if they have clinical records, they are accountable for ensuring that they are safe and secure, and that if clients need access to them, that they can provide access. So there will no longer be a requirement to remain registered either as non-practicing, because it won't exist, or full in order to retain custody of your records. The other concern that we've heard is around whether, if you're no longer registered with a college, whether you can obtain professional liability insurance to protect yourself after you've finished practicing. And there are, and the recommendation is to be in touch with your professional liability insurance provider. Most of them, if not all, will have some form of insurance that is possible even if you're not registered with the college. Okay, we'll go through this line by line. Don't jump ahead. Here are some specific, I just want to talk about some of the specific changes that are happening with some of the licensed classes. So we talked about this. For audiology, there's a conditional class of registration right now, and that's going to be, it's a name change, it'll become provisional. In dietetics, the temporary class, as it is now, will become a provisional class in name. There's also currently an emergency class of registration in dietetics, and that one's going to be discontinued. From what I understand, it hasn't been used, and we're anticipating that in an emergency, there are provisions for quickly licensing professionals who are needed in BC, and we will have the time-limited temporary class as well. Hearing instrument dispensing, conditional class becomes provisional. This is where it gets interesting. So opticianry currently has two registration classes that are effectively independent practice. So the first one is the registered optician and contact lens fitter, and the second one is the registered optician. There will be one class for independent practice, that's the full class. So registrants who are currently in either of these two opticianry classes will become full on April 1st, with the qualifier being that going forward, in order to be eligible for a full license in opticianry in BC, you must have both the optician and contact lens fitter qualifications and exam completion. So new licensees to BC in opticianry have to have both of those. Current registrants who are only have the optician credential will have the full registration or license class, but they will have a limit on their license in that they cannot provide services as a contact lens fitter. Hopefully that's clear. We have a similar situation in optometry. There are two classes of registration that are equivalent of independent practice, but they have slight differences. Most optometry registrants are in the therapeutic qualified class, and then we have a very small number who are in the non-therapeutic qualified. Both of them, again, will be full registrants in optometry as of April the 1st, and those who are currently non-therapeutic qualified will be required to practice within their competence, which is that not to provide, I have this written down, not to prescribe, dispense, or administer therapeutic pharmaceutical agents. So that's the difference with those. And the Optometry entry to practice education, it includes those skills. And so new optometrists coming into BC will be required to have that. Optometry has two other classes that will be discontinued. They're the limited and the academic classes. Physical therapy, it's the only profession that we register that we regulate that has a student class, and that will be discontinued as of April the 1st. Psychology has quite a few classes of registration. There are two that are the equivalent of independent practice. So currently they're registered psychologist and licensed school psychologist. Those will become respectively full class of license. There is also an associate psychologist class and a psychology assistant class. Those will both be discontinued. The very, very, very small number of registrants have been contacted about their options, and that's why there's a TBC. We have options to accommodate them within the classes that are in the new bylaws. Additionally, psychology has two very specific classes of temporary registrations. One is supervised and one is emergency. Both of those are being discontinued. We can accommodate the provisions for both of those in either the new temporary class and the provisional. And finally, speech language pathology currently has a conditional class, which will change name to become provisional. Good thing this is being recorded because I'm sure people will need to go back and look at this. Okay, pardon me. Talk a little bit about renewal and reinstatement. So we've harmonized basically everything about registration or license renewal. All of the requirements are the same for all 9 professions in the bylaws. You'll still see in the renewal period coming up in 2026 before March 31st, you'll still see a couple of profession-specific differences, but we expect them to be completely aligned for the renewal in 2027. You'll receive notice of renewal by February the 1st, and then it'll be open for anywhere between 4 to 6 weeks, ending on March the 31st. For 2026, I'll just let you know, we plan to open it on the 18th of February. And then in the bylaws, and has varied by profession, even since amalgamation to some extent, but all professions are going to be the same. If someone has not renewed their license by the March 31st deadline, there will be a period during which reinstatement after that failure to renew is possible. That's April 1st to April 30th. And the same late fee applies to all professions, plus, of course, their respective professions' annual license fee. Okay. There are some changes to certified practice. Now, this currently only affects the audiology, hearing instrument dispensing, and speech language pathology professions, because they're the only ones that have, at this point, a certified practice program in place. Those have been running on a 3-year cycle. We're transitioning them to an annual cycle. So if your certified practice is due to expire March 31st, 2026, then you want to renew it, you'll renew in the renewal period in 2026, and it'll be renewed for 1 year. If you have a certified practice that's due to expire March 31st, 2027, you'll renew that by March 31st, 2027, and it'll be renewed for 1 year. Similarly, if you have a certified practice due to expire March 31st, 2028, so you just renewed yours in the spring this year, you'll also renew by March 31st, 2027, and that'll be for 1 year. And so then we'll have all of them on a 1-year annual cycle. And significantly, currency hours will no longer be a renewal requirement for certified practice. Okay. Okay, reinstatement. So there's I always have to explain this. There's that reinstatement after failure to renew. So that's just the 30 days after the March 31st deadline. Anything beyond that 30 days, it's also called reinstatement if you were formerly a registered with either this college or Legacy College, pardon me, as long as you were a full registrant and you want to return to full. So we've harmonized the requirements across the board. So all 9 professions have the same requirements and process around reinstatement. But it's very specific about who it applies to. So it applies to former licensees who held a full license or registration, accommodating the terminology, within the previous 3 years. Your license cannot have been suspended when you were last a licensee. Your license cannot have been revoked or canceled. You could still find a way to return to being licensed in BC in those scenarios, but it's not the process that we were referring to as reinstatement, which is a very streamlined. And you also could not have had a license in another jurisdiction suspended, revoked, or canceled. So the what's so streamlined about it? Well, the fact is that basically you'll fill in an application form, updating your information online. You'll provide proof of professional liability insurance coverage. You'll provide verification of licensure if you had been registered in another jurisdiction. And you may be required to provide what is the equivalent of a criminal record check if you've been practicing outside of Canada. Other than that, those are the requirements. So you can imagine that can be processed fairly quickly. The reason that we did this was, there's reasons for choosing 3 years. There's literature that looks at, duration out of practice or duration out of practice in a certain jurisdiction. And 3 years was a safe span of time to imagine that we could reinstate somebody who had previously been registered with us. And one of the assumptions is that if we were regulating you less than 3 years ago, then we've had recent eyes on you. And when we have a quality practice program running again, you would have been complying with all that. So the risk was deemed to be low, and the trade-off being that somebody who's been out on a parental leave for a short time, less than 3 years, has an easy way back in. And the other thing is, so I think we had a question about this, but we can talk about it now too. The fee is it's a $265 application for reinstatement fee, and that's the same across all professions. And then you pay the annual license fee for the profession that you're applying for reinstatement to. And contrary to what Diane said, she went into more detail on the information records on vaccination than I was actually going to go into. So I don't think, I think this just reiterates what she was saying, but she said it much more clearly. So I don't think we need to spend more time on it. Okay, so in terms of the next steps, the complete bylaws are going to be posted for consultation. So you'll see everything in one place, and you'll see the changes that have been made based on feedback from the consultation process in the summer. We had a lot of, as Diane said, we had a lot of feedback. The ones that were, well, for example, there were a lot of errors in the recognized education program schedule. Those have been fixed, and they've actually been, I think they've been improved. I don't know why we didn't put them in alphabetical order in the first place, but somebody commented on that, and I thought, of course, we should have done that. So they're all in alphabetical order. We also integrated, we had in those bylaws that are currently up on the website and that you're able to provide feedback on last summer. There was two different schedules, one for the recognized academic programs and then one for practical training, and we put those together. I think it makes a lot more sense in it. Currently, some of our professions have eligibility standards that are specific to the academic and specific to the practical training. We'll be looking at some point to integrate those. But what we've done so far is just integrate them in the schedules. There'll be a registrant/licensee newsletter coming out in January, and we'll have some more information in there on some of the changes, particularly around the classes of license. You can expect, like I said, renewal notices on February the 1st or thereabouts. We've already started actually transitioning terminology and website content, but that you'll start to see more of as we come up to April 1st. It's very difficult to just flick a switch and within one day have all the terminology changed, but we're basically going through a process right now to map where the terminology needs to change, and so that and making decisions about what we can safely change now that won't cause confusion and what needs to wait. Well, you can also expect to see more details of the provisional license coming up. Pardon me. And we haven't talked about this at all, but the folks who are returning to practice after absences of more than 3 years, and I'm talking about absences like from practice completely. What are the pathways for that? As you can imagine, it's all over the map right now. We're administering as many different processes as we had legacy colleges, actually, and probably multiply that by 2. So there's a lot of variation, and it doesn't make sense to have so much variation. Yes, there will be profession specific things that we have to take into account, but how long does it take to lose your competence in a profession? Like if you're out of it, that kind of thing we can probably harmonize, because that's the sort of thing that would be similar across professions. But we have to look at that one. It'll probably be a graduated process to harmonize these and flesh out the details. Pardon me. So initially, I would hope that we get into April 1st with the kind of high level process established, and then the details will come as the license committee reviews cases and applications on case by case basis. They'll start to see the patterns and how they want to go forward with a more consistent approach across the professions and where it needs to be different. What you can expect after April 1st. Appreciate your patience on this, but the interactions with the licensure team will be slower. They have to make sure that the terminology changes that we've talked about are carried through both on the website, in all of our documents, in Alinity, which is the regulatory licensing management system that we use. So they're going to be adjusting to that. They're going to be adjusting to new policies and procedures that will be in effect. That's one of the things that does just turn over on from one day to the next. So we're going to need some time for them to learn and to become comfortable with interpreting or applying the new act and the new bylaws. We will be answering the phone and emails, but it'll just be instead of a week's turnaround, it might take longer than that. But I think that will only be slowed down for probably for the month of April, because we'll be dealing with that as well as reinstatements after failure to renew across 9 professions all at the same time for the first time. So I think we'll be back to normal by May. That's my estimate. Also, after April 1st, there will be policies that are in place that comply with the HPOA, and they'll be harmonized across professions. We currently have approximately 60 different policies related to licensure because Profession A has their own language proficiency policy. Profession B has theirs, and C and D. So we're going through a process. We started a while ago to identify which ones we can harmonize, and then redraft them to be compliant with HPOA and with the new bylaws. That's a huge task. But we'll have the ones that have to be in place on April 1st. They'll be in place, and there'll be others that come along after that. Okay, I think, oh, right. That's the end of my content. I had to put a plug in for the rest of the webinar series, and then we'll get to questions. January 14th, there'll be a webinar on delegation. That's at 4 o'clock. January 29th, quality assurance and continuing professional development, also at 4 o'clock. And the webinar on discrimination, which is a particular focus of the HPOA, will be in sometime in February. Watch for a detailed date on that. And then complaints, discipline, and support programs is yet to be scheduled. And same with the harmonized ethical and practice standards, which hopefully you're all providing feedback on that survey that all registrants received. Okay, Michelle, questions that we received in advance.
Yes, and we received a number of questions during your presentation as well, a lot of really good questions. So I'll start with the pre-submitted ones, and then as time is available, we'll go to the submitted questions. So thanks, folks. And if you have any that you want to submit now, you can certainly do that. And we will be updating our Q&As online later on to address any questions we don't get to today. So the first question, Chris, is can the college explain why PTs, optometrists, and psychotherapists in the future can apply for a health professions corporation permit and not the other professions?
That is such a good question, and I wish I could explain it. Diane, can I throw that one over to you?
Sure. Yeah, it is a great question. So I think for physical therapy and optometry, these are very long-standing requirements. If you are working under a corporate structure, that there's a requirement for that corporation to have a health professions corporation permit. With respect to psychotherapy, we learned of that when we saw the regulation. And my understanding is that the ministry is of the view that many psychotherapists work under a corporate structure as opposed to us being a sole proprietor or having a limited partnership. I think the benefits of health professions corporations, might have existed a number of years ago for professionals. We're not convinced that the same incentives to have a health professions corporation permit continue to this day. So we are in discussions with the ministry about whether or not we could have a policy review done with respect to HPCs and the requirements to hold a permit. There are some restrictions on who can apply. It impacts multidisciplinary practices, for example. And so we think that we do need to look critically at whether or not HPCs make sense in the context of the professions that we regulate. So I think the answer is a lot of historical perspectives on HPCs. I think way back when there was a thought that maybe by having a health profession corporation permits, there might be some control over corporate structures. That's long gone. There are lots of corporate entities that own health care practices and control interest in that. So I think some of those issues that might have initiated the conversations about HPCs no longer apply. I know that the psychotherapy profession, the BC Clinical or Association of Clinical Counselors, for example, have provided lots of feedback to the ministry on the requirement that psychotherapists would need an HPC because I think the majority of them do work under sole proprietorship models as opposed to corporate models. So stay tuned on that.
Thanks, Diane.
Thank you. I have another question we received in advance, Chris, regarding use of doctor title. So we have a psychologist, it looks like, who's interested in knowing if they can use the term doctor or DR in front of their name and if the college will permit that.
I believe that's permitted under both the current and the new regulation. So it will be permitted. I think the proviso, as always, is that you're clear that you're not a medical doctor.
Yeah, maybe I can add to that. So the Health and Care Professions Regulation in Section 5 actually speaks clearly to this, that if you do hold an academic or educational credential that allows you access to the title doctor, that you may use it, but you must be very clear that you are not a medical practitioner. So I would refer you to that section in the regulation if you're interested in reading it.
Thank you both. I am going to jump to some of the live questions. There's a lot of interest in provisional class, and seeking information about what that means and who can apply for a provisional class. This one's about supervision. What is considered supervision for the provisional class, and does a person need to report to another person of the same profession, or can they be sole charge within a health authority and report to their manager, who is likely a nurse?
Yeah, good question, because I know that because this is one of the differences across the professions right now. What exactly qualifies as supervision? What and I think the requirements to demonstrate that you are supervised vary a lot as well. It is important to remember that someone who is in the provisional class has not fully demonstrated their entry to practice competence. And so there is an element of risk for them to be practicing without supervision of some kind. So that's the point that we started from. We don't want to create barriers for professions where there are limited opportunities to work with an experienced person in the same facility and have them supervise them. But there will be a requirement that the supervision be by somebody from the same profession. Whether that is, I know, for example, right now, in dietetics, it's possible if you're in a sole charge role, you can be supervised, have some kind of arrangement with somebody who is in a different facility. And so we don't want to shut the door on arrangements like that. We just want to make sure that there is adequate oversight of people who have not yet demonstrated that they are qualified to practice independently. So I think I've answered the question. Oh, you also said the part of that question or part of other questions was who was eligible for provisional, right, Michelle?
Yeah, we do have a number of questions, folks that, want to return to some kind of semblance of practice, and there being sort of a sense that provisional might be an option.
Right. Okay, so eligible for provisional. Basically, person must have completed a recognized education program or had their education experience been deemed substantially equivalent. And then if they're waiting for an entry to practice exam, for some of our professions, that exam only happens twice per year. So the provisional class is a good way to get into practice while you're waiting for that exam. For some like PT, where the new national exam is going to happen 8 times per year, there could be very little reason to apply for provisional. But so that's the starting point for eligibility. Regarding whether it's a path for reentry, it could be. At least it's there. And like I said during the main part of the presentation, the harmonization of reentry programs is something that we're still working on and hoping to have at least the high level harmonization sort of approach set before April 1st. Right now, for example, occupational therapy uses their provisional class as a pathway to reentry. I don't know if the license committee will continue that. I can imagine that it's a helpful option in some situations for reentry. probably depends on how long a person has been out of practice. And if the committee, looks at that duration and sees, well, it's a relatively short time and they've done things that are related to their profession, we just want them to practice under supervision for a period of time, so that we're confident that they're going to be independent and safe and effective. Then they might opt for that. So that'll be a decision of the license committee, based on some of the work that the team is doing to pull together what would be relevant for the different professions based on the practice context and patterns of practice and patterns of being out of practice.
Thank you for that, Chris. I've got a question here about the removal of the non-practicing category, and what is the new definition for having a license versus not, specifically for long-term disability?
Well, I don't think the definition of having a license or not has changed. If you're not registered with the college, you don't have a license. If you are registered with the college, you have a license in one of the 3 classes that we will have as of April the 1st. Long-term disability is that's an interesting one, because I wouldn't be able to expound on that too much, because I think there are factors that aren't solely up to the discretion of the college within that. There are aspects of employment contract and union rules that like if you need to maintain a registration in order to maintain your status in long-term disability, then that's what you have to do. But back to the original thing, if you're not registered with the college, then you don't have a license.
Thanks,
Chris. There might need to be a follow-up question from that. I'm not sure, but
okay, I'll look for that. I have a question here about, with the full class across all professions, will that require all licensees to pay the same amount in fees, even though some may not be qualified to do contact lenses in the case of opticianry? So I think that was in reference to some of the categories with opticianry, the 2 distinctions there, and if the fees for full
good question.
would be the same.
Yeah, good question. Yeah, no. So if you look at the fee schedule that will come into effect on the 12th of January, it's one fee for the full class, and it's the same fee actually for provisional. So if you're a licensee as a full optician, whether you have that limit on your license that you can only provide you're not allowed to provide contact lens fitting as a service, then you'll be paying the same thing as the other section.
Great. I have a question about reinstatement. What happens if you miss the 30-day window? Do you completely lose your license?
So then you can imagine, on May the 1st, you're basically canceled. So you're out of that 30-day window when you'd be paying, you'd be completing the same renewal form effectively as if you'd done it on time. The only difference is you're paying the late fee, which is $380, I think. Anyway, May 1st, you'll be paying the reinstatement application fee, and your annual fee, of course. And you'll have to provide those additional documents if those are relevant. Like if you've been practicing in another jurisdiction in Canada, or any other jurisdiction, you'd have to provide verification of license, possibly a criminal record check from another. Well, if you've been practicing outside of Canada, but and it wouldn't be automatically approved. So don't miss the deadline. But it'll still be you basically go into that fast track reinstatement, but it's certainly not as fast as just doing your renewal or even doing a late renewal.
Sage advice, Chris. Thank you. There's a question here. It asks, with the removal of currency hours, can licensees stay on a full license and not practice?
Oh boy. So the college doesn't control whether you're employed or not. We don't regulate that. At some point, there will be quality assurance requirements with the new program that I don't know what those will look like and how much that they will rely on some kind of practice. I don't know. So theoretically, yeah, I suppose you could stay registered and not actually practice, but I wonder what the point would be. And I wonder if there might be might have a bit of a challenge when it comes to those quality assurance requirements when they're developed. But we don't control whether you're working or not.
Thanks, Chris. I have a question here about terminology. Is there a grace period for changing documentation to reflect the change in title from registered to licensed? And how quickly do these changes have to happen? I guess that means with respect to stationery and things like that in a clinic.
Yeah, yeah, good question. Yeah, like yes. Similar to like our website isn't going to be fully compliant with the new terminology on April 1st. So we get a transition period, so you do too. I can't tell you how long it will be. I suppose at some point somebody might start pointing it out because it might be confusing to the public, but yeah, we don't expect you to flip the switch out, on April 1st. And remember,
Can I just add to that?
oh,
Sorry,
sure.
Chris, go ahead.
Yeah,
Go
no,
ahead.
go ahead.
Because we've had a few questions about this notion of using registered, whatever the profession is. And I know that there were legacy college requirements that mandated the use of registered X professional. It's not something that the college is overly fussed about because if you are licensed to practice and using the title, it means you are registered. And so while we're not going to police whether people use registered or licensed, it does beg the question of what that added value is from a public interest perspective. Our job is to make sure the public understands what it means to be a licensed professional. But we certainly aren't going to be fussed about whether or not people use registered or licensed before their title. Many professions have never used that. Some have had mandatory requirements, as I've said, but it's not something that we see from a risk perspective as being a high risk of public safety, for example. So leave it up to you to determine. We understand that professions that have had that historical practice have letterhead and business cards and websites, etc. And so happy for you to continue if that's what you choose to, but we're not going to be sort of overseeing that.
Thank you both. I think we might have time for one more question before we wrap up. Is there any prorating of license fees if you start or finish practice mid-year?
So that's for people who are new applicants coming in. The annual fee will be prorated after October the 1st. That'll be across the board for all professions. That was a short answer. We can squeeze in another one, Michelle, if you have one.
Okay, certainly. Let me take a look here. If a health professional had to give up their license due to lack of practice hours in the 5-year window, can they apply to be reinstated if it was less than 3 years ago?
The 5-year window. If right, so if they were last registered in the independent practice category for whatever their profession is, full or whatever, within the last 3 years, come April 1st, theoretically, yes. I'm saying theoretically just because there are situations or aspects of an application that might not fall into the specific criteria for that 3-year reinstatement streamlined process, but theoretically, yes.
Great, thanks. Do you think we can squeak in one more?
Sure.
Okay, these are going quick. If on maternity leave, can you remain on a full license? Do you have to cancel your current registration slash license and then apply for renewal?
Again, so your employment status, being on leave for whatever reason or whatever, it we don't control that. So if you want to be on parental leave and maintain your full license, that's perfectly fine. But you will have to make sure that your professional liability insurance is in place, because that is a requirement to maintain a full license. And some people choose, looking at the economics and things, they decide that they don't want to spend that while they're going to be on leave. So yeah, no, it's perfectly fine as long as you're meeting the requirements to maintain it. So professional liability insurance, and when the QA requirements come up again, to complete those as well. But yes, theoretically you can. You don't have to cancel and then apply back. That's just an option. It was a consideration for all those who do go on parental leave, for setting that 3-year mark, so that it's relatively easy to come back if you choose to cancel your license or registration for that period of leave.
All right, I think we're down to 2 minutes. So I do see a lot of questions, Chris, about provisional registration still.
Yeah.
And I think it's fair to say that Chris and her team are still working through all the criteria for provisional registration. Chris, is that fair to say? And that you'll be sharing more information? There's a
Yep.
lot of policy work to do between now and April 1st around this for those professions that have had provisional registration. We're certainly not guaranteeing a duplication of what the criteria might have been that will carry over. But today, we're just not in a position to answer all of the detailed questions about the criteria that will apply for provisional. So stay tuned for more information about that. Um, I would just like to encourage all of you to consider responding to the standards survey about the harmonized standards. I think Chris mentioned this earlier. We're really doing our best to send out reminders, and I think we've had, as of yesterday, we've had almost 1,600 responses, but we would really like to have more than that. So please take a few minutes. The average length of time to complete the survey is 22 minutes, so not too much of your time. And also just to let you know that the consolidated HPOA bylaws will be up, I think, either Michelle today or tomorrow, certainly within the next 24 hours. We received them all last night, and that will include a number of the schedules. There's a few components of the schedules that we need to finish, but for the most part, they're all included. And so you will get an email about the HPOA consolidated bylaws. You'll see in there where we've made a number of changes, and certainly happy to receive any feedback. We're leaving the consultation for the consolidated bylaws open until January the 15th, after which time we will be finalizing them and taking them to the board with a recommendation for their approval after the HPOA is in place. So thank you so much for joining us today. We will keep track of the questions and certainly address the questions we haven't during this webinar as part of our frequently asked questions document on the website. But thanks again for joining us today. Have a great day. And thanks, Chris, for your time.
Oh, pleasure. Thanks, everybody.